my work is entitled Beyond Pain Relief: Acupuncture as a Healing Alternative to Medication. I'm a strong proponent of using acupuncture as opposed to taking pill medications for pain, because I believe that pain medications tend to have a lot of consequences and side effects. And according to the CDC, over 20% of US adults are suffering from chronic pain. And chronic pain is often debilitating over time and causes people to, lose a lot of function that they would normally have. And this includes mobility, so they would be sitting in a place for a long time. And this by itself tends to cause a lot of other side effects. The results include reduced mobility, emotional fatigue, and overdependence on medication. And the Western approach would be to block pain pathways and neurosignaling by using a drug. And the TCM approach would be to investigate internal imbalance, so to see where there's stagnation, if there's any deficiency, and any energetic dissonance. So the objective is not simply to mute pain, but to restore natural physiological function. So in TCM, our approach is not just to stop the pain, but also to completely reverse it and make sure there's no pain to come in the future. This person is in a lot of pain. You could see that pain affects the brain and causes a lot of problems. And pain medication mechanisms and limits. So primarily functions by blocking pain receptor neurotransmitters. The pain medication is often rapid, but has transient relief without addressing causation. And it requires recurrent dosing, and over time this increases over time due to tolerance. So people tend to take it longer and more at a higher dosage. And does not intervene in circulatory, energetic, or tissue repair process. So it doesn't help with any of that. And it focuses on suppression and not restoration. So these are just some medications someone would probably use. And the long-term consequences of medication, it's estimated that 1.7 million affected by opiate dependency in the US alone. And NSAIDs, they're linked to GI, gastrointestinal damage, renal strain, affecting the kidneys, and inflammatory consequences. Continued use may cause fatigue, mood instability, diminished immune resilience. And long-term medication can also delay the natural healing ability within the body, the mechanisms, and increases chronicity risk. It also creates a cycle of dependence without addressing systemic disharmony. So some of the long-term consequences is that the person might be on that pill for months and years. But thankfully, luckily, we have a solution, and this is acupuncture. And acupuncture is very amazing for pain, and it's just an alternative for using drugs. It's a very good alternative, no side effects. So acupuncture stimulates the sensory nerves. It triggers endorphin and serotonin production, so it causes the feel-good hormones to be released. And it improves microcirculation and tissue perfusion, inflammation modulation. It helps with, restoring proper flow within the body, getting the blood moving. Balances the autonomic nervous system, and it promotes parasympathetic recovery state. So people are in a state of healing as opposed to panic. In the fight or flight, their body's healing. And from a TCM perspective, acupuncture works by moving stagnant qi in blood. It nourishes deficiencies and it clears any obstructions. And it guides the body back to its self-regulatory healing capacity. It wakes the body back to its proper function. Here are some of the needles that an acupuncturist might use. In the TCM diagnostic, the Chinese medicine diagnostic and perspective on pain is that pain is a manifestation of stagnation. Where there is obstruction, there is pain. Where there is blockage, there is pain. And may arise from qi stagnation, blood stasis, cold, damp, or any deficiency of the qi, yin, or yang. Differential diagnosis determines point selection, treatment intensity, and adjunct therapies, so it just depends on the type of pain, we can adjust our modality. And the clinician evaluates the tongue, pulse, emotional state, lifestyle factors, and pain patterns over time, so it's very it's specific to the person involved in having pain. It's not like having a pill and the person will just take the pill, and regardless of what type of pain, is standard for everyone. In acupuncture, it's very customized. It emphasizes on individualized treatment, not identical protocol for two patients with the same pain location, and the objective is to uncover the nature of imbalance, not merely the site of discomfort. In TCM, we do not chase the pain, we trace the imbalance that created it. And these are some of the herbs in Chinese medicine. So some of the clinical evidence, it shows that acupuncture is more effective than NSAID-S. And this was using thousands of patients. And it demonstrated sustained relief extending 6 to 12 months post-treatment completion. So people are having sustained relief from acupuncture, lasting months and months. It's endorsed by the WHO, NIH, NCCIH as an evidence-based clinical integrative therapy, increasing global incorporation into multidisciplinary pain management models, and supports both acute symptom relief and long-term regulatory adjustment. And the clinical advantages of using acupuncture is that it treats root dysfunction rather than simply muting symptoms. Minimal adverse effects, low relapse probability, enhances sleep, emotional regulation, digestion, hormonal and neural balance. It reduces pharmaceutical dependency on drugs and frequency of medical intervention. And so it relieves a lot of strain on the medical industry. It promotes patient self-healing and physiological realignment. And when it's done integratively, the highest results are achieved when acupuncture is paired with herbal medicine and body therapy. So in acupuncture, we use cupping. Cupping is very efficient as well. Supports integration with physical rehabilitation, qigong, physiotherapy. Encourages nutritional and lifestyle modification to sustain recovery. Incorporates psychological and emotional support for full spectrum healing. And the focus shifts from symptom recovery to holistic restoration and life quality enhancement. So it would be very beneficial for people who are on pain medications to give acupuncture a try and try an integrative approach to see how they will feel. So here's a side-by-side of the drugs and herbs. From symptom suppression to patient empowerment, conventional care often leads patients to identify with their diagnosis, fostering dependency. So people's diagnosis, their illness becomes their identity. Acupuncture reframes pain as a reversible state, activating biological repair rather than passively enduring pathology. Encourages patient participation through lifestyle shifts, movement therapy, breathwork, and diet. Restores agency, resilience, and hope, allowing patients to transition from feeling treated to feeling transformed. Aligns with integrative medicine's movement toward preventative and restorative healthcare models. And it represents a shift from crisis intervention to cultivation of health intelligence. And a quote that I really like is, healing is not merely the absence of pain, but the return of harmony. Acupuncture does not silence symptoms, it teaches the body how to speak in balance.